I'm Rachel Houghton with Legacy EAP. We are your employee assistance provider for Corley Manufacturing. And today I'm going to talk to you about the drug-free workplace. You work in a company that is a drug-free workplace, which means no drugs, no alcohol are allowed on the premises. You can't come to work intoxicated in any form or fashion. And if you were to test positive, then there is action that's going to be taken. And so what I want to talk to you today about is exactly what that policy looks like, and as an employee of Corley, then what that means for you. So let me tell you just a little bit of background on drug-free workplace and why it's even in existence. So back in the 80s, there was a really big problem with alcohol in the workplace. And a lot of companies were unionized. And so with that, people were coming to work intoxicated, and there was just a big problem. So President Reagan decided to enact the drug-free workplace. And what that means is there's now rules and procedures that are given to us by the federal government, which tells us what we can do and what we can't do legally for drug and alcohol. And so basically what it means is that with you working at Corley, Corley does get a discount on the workman's comp premiums because they are a drug-free workplace. But in return, they have to follow all the rules and guidelines for the drug-free workplace rules. So what that means is there's a few things that Corley is required to do, and one of them is this training, that as an employee, you are taught exactly what your rules and rights are, and then what Corley's rules and rights are, and how those two things work together. So number one is that if you are watching this video, then you have been employed by Corley. So that means congratulations, you passed the drug test for pre-employment, because that's number one. What you're going to do is that you will be tested pre-employment to see if you are able to work, which congratulations, you passed. Good job. And so now you're watching this training, and what that means is that we are now going to look at what your rights are and what Corley's rights are, like I said a few minutes ago, for moving forward. So know that here's the policy, and I'm kind of looking at it. I have a copy of it in front of me, of Corley's policy, and so I'm going to go through that with you a little bit on what that looks like. And I'm sure they're going to give you a copy of this, but it is a violation of the policy for you to use, possess, sell, trade, offer for sale, or offer to buy illegal drugs, or otherwise engage in illegal use of drugs on the job. Okay, so when you are at work, you cannot do any kind of drug, anything on the job. Okay, so that's number one. Number two is that you cannot report to work possessing any drugs or being under the influence. So you can't have them in your body, in your urine, or any illegal drugs in any detectable amount. Okay, so that's number two. Number three is that you cannot report to work impaired with alcohol at all. And number four is that you cannot come to work with any prescription drugs that are not yours in your body. So that's an important one that I really like to spend a little time on and talk about, because 1 and 2, you don't need to come to work under the influence of any drugs or any alcohol. Okay, but number 3 is a bigger deal. And here's why. Because it is unfortunately become common practice. I'm gonna give you an example of like back pain. So I have back pain, and I'm over at my parents' house, and my mom says, "Oh, I've got some muscle relaxer that you can take that'll make your back feel better. Here, take this." That is a violation of the drug-free workplace policy, because that is not my prescription and it does not have my name on it. So I do not need to take it ever. Okay? Absolutely not. Do not take any drugs that are not prescribed to you. So that's number 1 of that. Number 2 of that is, okay, so let's say you have a prescription for something, but you are using it incorrectly. that is a problem, because when you are drug tested, they are going to look at the amount of the drug that is prescribed to you that's in your system, okay? So I'm going to give you an example. Let's say you are prescribed some kind of opiate for back pain. We're going to keep with the back pain idea. Then you should have about 1,500 to 2,000 nanograms per milliliter in your system. If you, so if that's the case and you're drug tested and they say, oh, they've got opiates, but you provide the prescription that says, yes, I have a prescription for this and I'm using it correctly, then everything's fine. But if you provide the prescription and they take a look at how much you're using, and all of a sudden it comes up with 52,000 nanograms per milliliter when it's supposed to be 1,500, they're gonna know that you've taken half the bottle or the whole bottle. And that's not okay. That shows that you're abusing that and that you still have a problem, and that is something that you can definitely be in trouble for. So just know, please don't, it's against the policy to ever take anybody else's prescription and to overuse your prescription, because they do test for that. Okay, and then number 5, the violation for this policy is, it could be a disciplinary action of some sort up to termination for misusing the drug-free workplace policy. Okay, so those are those. Now, here are some things that Corley is part of the drug-free workplace policy federally, of why you could be tested, okay? So if they were to see, if your manager was to see changes in your work, like let's say you are usually right on top of things and all of a sudden you aren't showing up to work, you're absent a lot, you're tardy, or just your job performance changes, they can decide to do a drug test on you and test you for drug use. So that's one thing that they can do. And here's the thing. Your manager is not going to be going around looking and trying to see, oh my gosh, who's using drugs, who's not, that kind of thing. But if there's some kind of significant change, they have the right to test you, and so they can do that. They want to respect your individual need to maintain a safe workplace. And so, do you want to be working next to someone who is possibly using drugs or alcohol on the job? Because that puts your safety at risk. And so they want to make sure that the workplace is safe for everyone and that it's a productive drug-free environment. And then know that if you or a coworker were to have a problem, you have us as your employee assistance program that you can come and talk to. You can voluntarily call us. Our number is 706-272-6558, and we are available all the time to talk to you about things that may be going on. And if you do have a drug or alcohol problem, we can get you help for that. And Corley typically is able to stand by you in that and wants to walk you through that. Now, there are some cases when that's just not available, and you're putting yourself and your coworkers at too much of a risk, and they do have to terminate you. But typically, help is available, and especially if you ask for it, they're going to get you that help, and that's what we're there for. So know that that is an option, and we're going to talk about that more in a little bit. You do have the opportunity, if you were to test positive, to explain why this has happened. And you have 5 working days within receiving written notice that you failed the test to explain that, okay? So there is that. And know that all of this is 100% confidential. So it's totally confidential between you and the company, and it does not get out. Same with employee assistance. If you were to come see us, everything is 100% confidential. We do not share your information with anybody ever because we want to keep our licenses. We don't want to lose that. So there's that. So we talked about when you get tested. Like we said, congratulations, you have the job, and so you passed your pre-employment drug test. The other times that you can be tested were reasonable suspicion, and we talked about that just a little bit, that your job performance may change a little bit. Somebody's observing things being a little different for you, or a lot different actually. Abnormal conduct or behavior. So let's say you're pretty much always a laid back person, and all of a sudden you're yelling and screaming at people, or throwing a fit, or having weird anger outbursts. That could be something that could get you a random drug test, because that's just not normal for you, and the company needs to know why you're acting so abnormally. If there is a report that someone has seen you using on the job from a credible source, then that could also land you a drug test. Or if there's any evidence that you've been tested but have tampered with that test in any way, that could also then get you another test. Or if there is information that you have contributed or caused some kind of accident at work, that could do it. It doesn't do it all the time, but if there's some kind of big accident, you may be tested at that point. Or evidence that you have used, possessed, sold, solicited, or transferred any kind of drugs on work time, that would also get you a test. Okay, so those are the reasons why you could, reasonable suspicion, be tested. If you have some kind of on-the-job injury and it's a big thing, you will probably be tested then, and that's just, again, part of the protocol. Or if you have, another way is that if you have actually gone into treatment and have come out as part of that treatment program, you are required to be tested, then that would be follow-up from that rehabilitation, and then that would be a reason for a test. Or sometimes there's just a fitness for duty test that is done, and drug and alcohol testing can be also done for that. So those are the reasons that you can be tested, all right? Now then, alcohol consumption on the premises is prohibited, totally, which that means not okay. You cannot do that. So if for some reason somebody thinks that you may have been drinking on the job, you can be tested for that. And because we have to make sure that the company, everything is safe for you and for your coworkers. Now then, if you fail to submit that test and choose not to be tested because you're afraid you will test positive, or you just think, it's against my rights for you to test me, you can be in trouble for misconduct and have discipline action for that, or even be terminated. In a lot of companies I work with, Corley's not this way. Corley gives you some chances in the right scenarios. But in most companies that I work with, if you fail to comply with the drug test, you're just automatically fired. No questions asked. So the fact that it could just be disciplinary action is Corley cares about their employees and wants you working, and so they're not going to be punitive about this. If they feel like there's a reason for you to be tested, then there's a good reason that they have decided to do that. Okay, so know that. So if you refuse to submit the test, you can be terminated. So just wanted you to know those kind of things. Then I also want you to know some of the things that you are tested for, because it's a urine drug screen. So that means that you are have to provide your urine and are tested that way. And the things that you're tested for are amphetamines, cocaine, marijuana, opiates, PCP, barbiturates, benzodiazepines, propoxyphene, methadone, methaqualone, and then pH nitrates. And so where we get into that prescription drug piece that I was telling you about, that if you were taking somebody else's drugs or taking too much of yours, that's going to be a lot in the opiates and the benzodiazepines that you could be taking. That's where that amount is going to come into place. So just want you to know that those are the things that you are tested for, and because we want full disclosure so that as an employee of Corley, all the facts and everything is upfront and honest, okay? So those are those things. Now then, there is one other thing that I like to talk about when I'm doing the drug-free workplace training, because I think it's really important. is that CBD factor. Okay, because a lot of people now are using CBD oil or things with CBD in them because, you know, the truth of it is it helps a lot of people with when they're having pain for joint issues or all different kinds of things. Okay, but here is the thing that you need to remember. When it comes to CBD, no matter what the packaging says, at this point, it is not FDA regulated, which means the Food and Drug Administration have no regulation over it. So when it says it does not contain THC, that may not be totally true. There may be trace amounts or even a little bit more than trace amounts of THC in it, which means you could fail a drug test. So I just always want everybody that I work with aware that that is an option, that could be in the CBD, and just beware. So there's that. The other question that I get asked a whole lot is, well, what if marijuana becomes legal? Well, first of all, right now it's not. It's not legal in the state of Tennessee. So there's that. But if it does become legal, it will be state by state, not federal government. And the drug-free workplace policy, like I said in the beginning, is federally regulated. And so we will still have to follow the guidelines of the federal government. You know, so there's still, I'm seeing lots of research on kind of what people think might happen, but the basis of it is let's say tomorrow Tennessee passes a law that says marijuana is legal, it still won't change your drug-free workplace policy. Okay, so just know that. Then that last thing that I want to talk to you about is your option for an employee assistance program. So employee assistance program is short-term counseling that Corley pays for and provides for you to have. And so it's not just for drug and alcohol use and issues. That is a big part of what we do, and we are really equipped to handle that. But it also, if you're having marriage issues or family issues, issues with your children, anger, stress, anxiety, any of those kind of things, that is another reason why you can choose to access your employee assistance program. Like I said, it's free. You get an assessment plus 6 visits a year with us, and it starts over every year, okay? So after you've used us, you can use us again the next year, but it's open for you or for your family members. And so just wanted you to know that you have access to the employee assistance program, and you can call us. So you don't have to go through human resources or anything like that. You can call us. I said the number earlier. I'm going to say it again, 706-272-6558. And we've kind of changed the way we're doing things because of COVID-19. We do have an office on Gun Barrel Road that you can come to, or we can also Zoom or do phone sessions if we need to do that. So there's several options that we haven't had in the past that we do have now. You just have to call and make an appointment. But we would be more than happy to talk with you and to help you walk through any kind of life things that are happening right now. Or if you just think, I just don't know what to expect next and needs to talk to somebody about that, that's another good reason to give us a call. So again, thank you for this time and taking a few minutes to hear what I had to say about the drug-free workplace policy. Pretty much, don't use drugs. Don't use alcohol. When you're going to be working, don't use drugs at all. Alcohol use limit, especially if you know you're going to have to work the next day, and you'll be fine. But thank you for this time, and I'm so excited that you are working for Corley. It's a great place to be. Again, it's Legacy EAP, 706-272-6558.